I hurt my back a couple of years ago. I thought I'd never get rid of the pain, but I did.
I thought no back could hurt as much as mine did. I could barely get out of bed in the morning. My doctor said it was up to me to make some changes in the way I did things. And now, I'm back to work.
I was determined to get rid of my back pain, so I started an exercise program, and now I feel terrific.
While we all experience low back pain sometime, we rarely think about the back until it starts to hurt. The back is a marvel of mechanical engineering. The central structure is the curved spine, made up of 24 bones called vertebra that run from the base of the skull to the buttocks. Between each vertebra is a disc with a tough fibrous outer layer and elastic tissue surrounding a soft jelly-like material at the center. Discs act as both shock absorbers and ball bearings, allowing individual vertebrae to work with the one above it and below it, permitting the spine to bend, stretch, and rotate. Close to the discs are nerves that exit through openings between the vertebrae. These nerves branch off the spinal cord to other parts of the body. The spine is held in place by a series of ligaments and a group of muscles that hold it in a long S-shaped curve, keeping the body in a balanced position. In a normal, healthy back, everything works well together. But when they don't, pain can result.
Mr. Barunda, what brings you in to see me today?
Well, I've had a dull pain in my lower back for quite some time, and it really started to hurt last week.
Did you do anything in particular that might have set it off? Did you lift something heavy? Were you in a car accident? Anything you can think of?
No.
Is the pain just in your back, or does it go down your legs?
Just in my lower back.
Okay. Do you have any numbness or tingling? Do you have any weakness in your legs? Anything like that?
No.
In rare cases, back pain is caused by what is often called a slipped disc. The jelly-like material inside the disc shifts or slips inside the capsule, or actually bulges out of the capsule, pressing against nerves. In most cases, however, low back pain is caused by sprains or strains involving the muscles and ligaments. Pain may be felt at the site of the injury, or you may feel pain related to the injury in a leg. This is called referred pain and is very common. Depending on the cause of your back pain, your doctor may prescribe medication or other therapies to help relieve the discomfort.
We need to balance your muscles to improve your posture so that we can relieve the strain on your back.
What is good posture?
Good posture is standing, sitting, and moving, keeping the spine's natural curves balanced and in alignment in whatever you do. And here's where this muscle balance is so important.
Correct standing posture can be illustrated by an imaginary plumb line. Notice the natural curves of the spine in relation to the plumb line, and how ears, shoulders, and hips are stacked in a straight line. Poor posture means that the spine's natural curves are increased or decreased, contributing to muscle pulls and ligament strains, and creating abnormal pressures on discs and joints. To help when standing for long periods of time, use a step stool or something under your foot to shift your weight. This relieves the stress on the lower back and helps balance body weight. A step stool is also handy when reaching. By stepping up, you move closer to high objects and don't stretch the back. At home, while brushing your teeth, bend the knees to maintain normal back curves. And when vacuuming, sweeping, or raking, remember to maintain the normal curves of the spine, and be careful not to twist your back, but move your feet to give your body proper positioning. Walk with good posture. keeping head high, chin tucked in, pelvis in a balanced midline position, toes straight ahead, and wear comfortable shoes. Sitting posture is equally as important as standing posture. Sit in chairs low enough to put both feet on the floor, with your knees level with your hips. Your forearms should rest comfortably on the work surface. Instead of sitting up straight, sit with the natural curves in balance, one on top of the other. Don't slouch. This decreases the curves and can stretch the ligaments and muscles supporting the back, as well as pinch the discs. You may also consider using a small cushion or lumbar support on your lower back to relieve the muscle and ligament stress when sitting for long periods of time. The correct driving position is one that maintains the natural curves of the spine. Get into the car by sitting on the side of the seat and put one leg at a time into the car. Make sure the backrest is upright. Move the car seat to keep knees bent and level with your hips. You may want to put a small cushion behind your back to help maintain the curve of your lower back. When exiting a vehicle, swing one leg at a time onto the ground and stand up. When getting into and out of bed, remember to avoid stressing or twisting your back. Even while sleeping, your back needs support. Use a firm mattress and sleep on your side with your knees bent to keep your spine in balance. A too soft mattress can make your back droop and sag and can cause back strain. Use a feather pillow to support your head and neck. If you sleep lying on your back, put a pillow under your knees to relieve stress on your lower back. If you sleep on your stomach, use a pillow under your hips and abdomen to avoid back strain. Perhaps the biggest cause of low back injury is improperly lifting objects from the floor, shelf, or countertop. Don't use the muscles in your back to lift objects. Instead, use the supporting muscles in the abdomen, buttocks, and thighs. Here's how. Be sure to keep a wide base of support by spreading your feet apart to make yourself more stable. Bend your knees, not your back, and lift with your legs, holding the object close to your body. There are situations where you can't use proper lifting techniques, such as removing items from the trunk of a car or lifting a baby from a playpen. In these cases, move as close to the load as you can and, when possible, brace yourself by placing your knees against the side of the bin, trunk, or bed from which you are lifting. With your buttocks out and knees slightly bent, your spine will be in balance. Complete the lift using your arm, leg, and abdominal muscles. When the load is heavy, get help and plan ahead to avoid sudden load shifts. And always be sure of your footing. To move an object to the side, pivot on your feet as you move your back. Do not twist or bend sideways. Push rather than pull, and do the pushing mainly with your legs. And it's a good idea to use a cart or hand truck when you move a heavy object over a long distance. In addition to good posture and proper body mechanics, the greatest support you can give your back is to start an exercise program. People who don't exercise are more prone to low back pain and injury because muscle tone is poor, overall flexibility is limited, and supporting muscles can't do their work. This is especially true if you're overweight, because extra weight in the midsection changes your back's natural curves. A good exercise program should include specific exercises which strengthen the muscles in your back and abdomen and improve flexibility. Gradually, as you progress with your corrective program, you may want to include aerobic exercise, such as walking or cycling. Aerobic exercise will improve your overall fitness and help you to lose weight. The key is you. With the knowledge and determination to strengthen and protect your back, you can return to a normal, active lifestyle, free from back pain.